Hi everyone, my name is Dr. Lori Cayley. I am a functional medicine practitioner and I help women who have thyroid problems, specifically hypothyroid and Hashimoto's. I help them to reverse their symptoms. Today I want to talk about the proper blood tests that you should get if you think you have a thyroid condition or you do have a thyroid condition, but you don't think that it's being managed correctly, or you're taking medication and the medication maybe will help for a while and then it will stop working. And the in the medical community, thyroid health is not evolving. And functional medicine doctors are really the doctors who are on top of thyroid health and are the ones that are really helping patients to reverse their conditions. So this topic is really important because 1 in 5 women have a thyroid condition and most don't even know it. And it comes down to doing the blood test. So if you have symptoms of a thyroid condition, which would be the inability to lose weight or gaining weight and not changing anything in your diet, having anxiety, depression, mood changes, constipation, infertility, energy problems, fatigue, those are all signs of a thyroid problem. So I hear this all the time, that women will go to their doctor and tell them that they're having these symptoms, and the doctor will say, okay, well, check your thyroid. So they only check TSH levels. And many times those levels come back normal, and then the doctor will just say your thyroid is fine and you should change your diet or go work out or, just do something along those lines, but they're not really looking into what is going on. So that's why a lot of thyroid problems go undetected. So the test that you want to get is that comprise a full thyroid panel are the TSH levels, free T4, free T3, and then you want to get the thyroid antibodies, and you also want to get the T3, T4 levels as well. So you're getting a full thyroid panel and you're looking at all of the thyroid hormones, and you're also looking at the antibodies, and there's 2 antibodies that you want to have checked. And the antibodies are important to have checked because that can indicate Hashimoto's. Hashimoto's is an autoimmune condition, so it's not really a thyroid problem. And what will happen is you'll get leaky gut. So say you have a sensitivity to gluten and you're eating gluten, and then it will leak out from your gut into your bloodstream, and then your body will look at it as similar to the thyroid. It's a similar molecule to the thyroid molecule, so it will start attacking your thyroid gland. So it's not a thyroid problem, and it shouldn't be treated like it's a thyroid problem. But the only treatment that doctors have is to put you on thyroid medication to normalize blood work. And that's the only reason that they do that, but they're not fixing the problem and addressing the underlying cause of the problem. So there are many things that can affect and cause your immune system to go haywire and start attacking your thyroid gland. So it can not only be food, but it can also be underlying infections, viruses, parasites, anything like that can cause your immune system to start attacking your thyroid gland. So it is important to get it checked, figure out exactly what is going on, and it's also important to look at not only the T4 levels, but the T3 levels, because T3 is the active form of the hormone. So T4 is inactive and it has to be converted to T3. T3 controls your metabolism, your weight, your mood, your energy. So it's really important to know what your thyroid hormones are doing. So that pretty much sums up what I wanted to discuss about blood work today. Oh, and also, if anyone has any questions, please feel free to ask me now. Some common questions that I get are, what if your doctor won't order a full thyroid panel? You can always contact, and I would suggest go to a functional medicine doctor as opposed to your primary care physician or an endocrinologist. Or you can always contact me and I can help you get the blood work done. It's very easy to do that. I work with labs that you can get discounts if you don't have insurance. So, and then I can help you interpret those levels of from your thyroid panel. And often I also get asked, what do functional medicine doctors do differently? And with blood work, we look at optimal levels of blood work instead of just the ranges, the normal ranges that the lab gives. The normal ranges that a lab gives is an average of people who have gone into their lab usually for the last year. They just take those averages. Typically, it's sick people that are going to get blood work. So they are comparing you to sick people. And functional medicine doctors look at things very differently. We want our patients to be in the optimal ranges. We want our patients to be compared to healthy people. So that's how we look at blood work, not just thyroid panels, but pretty much all blood work that we have done. And I have a very comprehensive panel, not just for thyroid, but that covers a lot of different things because there's a lot of different things that can be affected when someone has a thyroid condition, like cholesterol. Usually, if you see high cholesterol, you'll also see that someone has a thyroid problem. So, vitamin D is another one that we look at. Vitamin D is very important. You want to optimize your vitamin D levels. I've seen a lot of people control their Hashimotos just by optimizing their vitamin D levels. So that's how we approach it. And another question that I get asked a lot is about medication. No, typically not. So you do not. If you have, if your thyroid has been removed, you have thyroid cancer, or if you had your thyroid irradiated, then you will most likely need to take medication. But no, functional medicine doctors typically do not recommend medication. Hi, Judy. For thyroid problems, you can use medication temporarily, but the way that we look at things is that when you are taking hormones for anything, you're going to be down-regulating your own hormone production. So because your body sees that you have thyroid available from medication, it's going to stop your own production of the thyroid hormone. So I do not recommend taking thyroid medication except for those 3 instances that I had already mentioned. There's nutritional support to help your thyroid, but you really don't want to or need to take thyroid medication except for those 3 instances. So if anyone has any questions, I would be happy to answer them now. If not, then I will be back on here next week and I will have a different topic regarding thyroid health. So I hope you all have a great day and I will talk to you soon.